Mantle cell lymphoma is a rare subtype of B-cell lymphoma. First of all, let me backtrack it. In America, the lymphoma population affects about 1 million people. In other words, 1 million U.S. citizens live with lymphoma. The overall lymphoma has a category of two parts: Hodgkin's lymphoma and non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma has T-cell lymphoma about 5 to 10%. The vast majority is B-cell lymphoma, which is about 85 to 90%. The B-cell, within the B-cell lymphoma, which is the most common type of lymphoma, there's many subtypes. Large cell lymphoma is most often, followed by follicular lymphoma, and then marginal zone lymphoma, and mantle cell lymphoma is just one of the many B-cell lymphomas. It is rare, but incidence is about 4,000 to 5,000 every year. So if the patient lives for, let's say, for the 5 to 10 years, on average 7, you would see that about 5,000 times 7, that's 35,000 people live with mantle cell lymphoma in the U.S. It's not a big number, but it matters on each individual patient. So mantle cell lymphoma is a rare subtype of B-cell lymphoma that is not yet curable, but many progresses are made in this field. And the mantle cell lymphoma, there is specific medicines approved by FDA just for mantle cell lymphoma. And so this subtype of lymphoma, although rare, but is enjoying rapid progresses. Mantle cell lymphoma is driven by cyclin D1. So the 11-14 translocation, there's a cyclin D1 which is supposed to drive the pathogenesis of mantle cell lymphoma. And when there's a translocation of this gene from the 11th chromosome onto the 14th chromosome, where there's a heavy chain promoter. Heavy chain is one of the most number of proteins. The amount of heavy chain in our body is a lot. So this promoter has a lot of work to do. It drive the B cell to make a lot of antibodies, heavy chains. So if any protein gene is placed after this promoter will overdrive the protein expression. So in this case, it happens under genetic environmental factors. The cyclin D1 gene is misplaced just right after on the 14th chromosome, just right after the heavy chain promoter. That's overproduction cyclin D1, which could drive the pathogenesis of mantle cell lymphoma together with many other factors on the molecular level and the cell pathway level. Morphological area, there's a controversy, but the most used variant are nodular, morphologically, diffuse, and then pleomorphic and blastoid. So from the growth rate, nodular is the slowest, and then diffuse a little faster. And so the slowest we use for lymphoma, we call it indolent mantle cell lymphoma. They usually are nodular, and the diffuse is a little higher. Then pleomorphic is very aggressive, and the blastoid is most aggressive. But sometimes people think it's the most slowest mantle cell lymphoma called a mantle zone lymphoma. And this was described by a hematopathologist from MD Anderson, but it's not overly used. Only certain people who knows this literature use the mantle zone lymphoma. This mantle zone lymphoma usually almost never need treatment for like up to 20 years. So mantle cell lymphoma is rare, and mantle cell lymphoma is even more rare. And a lot of oncologists or pathologists never get to see this.